Hello and welcome to In Our Community. I'm your host, Erin Nelson. Today I have joining with me Dr. Vance Johnson, who is a board-certified pain management physician here at the Corona Regional Medical Center. Welcome, Dr. Johnson.
Thank you, Erin. Glad to be here.
Let's go ahead and have our viewers kind of get to know you a little bit more. I'm going to ask you a few questions. And I understand that you have a lifelong relationship with the community here of Corona. Is it true that you were raised here in Corona?
That's true, Erin. My family came here in 1969 when my father, an orthopedic surgeon, moved to the community and began practicing here.
And as a medical student, what made you draft to the pain management side of medicine?
Well, I was raised under an orthopedist, so I was very interested in musculoskeletal medicine right from the beginning. At the time I was in medical school, pain medicine wasn't really recognized as a primary subspecialty. And so I was looking at helping people with pain. It is a basic ethic of medicine to help hurting people. That's kind of what I came into medicine with, an understanding that hurting people see their doctor and their doctors help them feel better. It's not the only thing that doctors do, but it's a primary part of it. And so I went in with a presupposition that I was going to learn to help hurting people. I looked for that as I went through medical school. With my interest in musculoskeletal medicine, I gravitated towards spine medicine. Hurting people tend to be hurting in their necks and backs commonly. Mm-hmm. And it happened that I was attending medical school during a spine revolution in treatment, and that excited me a lot.
Really? Wow. And how long have you been practicing here in Corona specifically?
My practice opened last fall, around October.
All right. And where were you at before you came here to Corona?
I was in Loma Linda, near the university there, and I'm glad to be back to Corona.
Be back to Corona. That's great. And tell us why you feel that pain management is so important, and especially with our community here of Corona, and why you wanted to have that practice here.
Well, it's especially important because it seems like everybody's hurting. I realize that I get somewhat of a skewed perspective because of my practice. However, there is a recent survey, many preceding that, but the most recent one is out of Stanford University. Recently reported at the American Academy of Pain Medicine, surveying over 1,200 Americans, and 1 out of 5 of them had chronic pain. Chronic pain meaning that they've had pain for 3 months, 3 years, 10 years. That's 20% of our country. So it's an underserved population, and Corona is no exception. Corona is a growing community, and likewise should be applied in there.
Right. And let's talk a little bit about why people get chronic pain. Is there a certain reason why, or certain people who do have chronic pain?
Yes. Well, let's take, for example, if you prick your finger on a rose, on that thorn, you'll feel a sharp, sudden pain in the finger, and you'll withdraw your finger very fast, maybe even before you feel the pain. That's a reflex at the spinal cord level that causes that to pull your hand back. The signal, however, is sent to the spinal cord where there are interpretations put on it, and then it is forwarded onto the brain, where more interpretation is put onto it. The brain then starts the body's pharmacy to release endorphins, which are like morphine, to help start suppressing the pain, but it also sounds an alarm, which gets many other systems in the body active. And so the pain can become much more complicated than the initial sharp pain. In most systems, in most people, the systems work properly and shut down the pain as it should, and the person heals just fine. Sometimes the wires get crossed, and the pain persists, and the other systems that got awakened by the alarm don't shut down when they're supposed to.
Right. Well, it sounds like there's a lot of science and thought behind why people have pain, and so let's hang on to that thought, and when we come back, we'll talk to Dr. Johnson a little bit more about pain management and what he has to offer here at the Corona Regional Medical Center. We'll be right back.
This is my friend Rodney. This is my friend Rodney on heroin. This is Rodney on heroin. Rodney on heroin. Rodney on heroin. Rodney on heroin. Rodney. That was my friend Rodney.
All right, well, welcome back to In Our Community. I'm Erin Nelson, and today we have with us Dr. Vance Johnson, who is a pain management physician here at the Corona Regional Medical Center. Welcome back, Doctor.
Thank you.
And we're going to kind of pick up where we left off, and let me ask you more specifically, what is pain management?
Pain is a noxious stimulus with a sensory and emotional component. So that affects body, soul, and mind. Management is an effort to control those, contain it, or even eliminate those sensations. Basically, when you hurt, you want to feel better. Pain has come a long ways, just in my career even, but prior to my career, there wasn't a whole lot known about many of the systems that we treat now. A lot of medications have arrived on the scene just in the past 10 years. Like I mentioned earlier, just when I was in medical school, I was amazed at the changes that were happening. Having seen some of the ways that my father treated musculoskeletal injuries and pain, I was impressed with the new options available to patients hurting, and so pursued that. I quickly learned that we are learning a lot about pain, but there's a long ways to go. Some of the symptoms I mentioned earlier, like the brain turning on its own pharmacy, is still a complex process we don't understand fully. But the door has been cracked open and we're peeking inside the pantry, and there's a lot of goodies in there. And so I'm excited about that, especially regarding the spine. Prior to just about 15 years ago, the spine was treated basically if you had a herniated disc, you got it cut out, and surgery was the main option, versus live with it. There are quite a few options now to save discs. Most people herniate their disc in their 40s, and so that's a young working person with a lot to lose.
Right.
And to go through a big operation to cut out the disc and fuse it is a lot to lose. It would be nicer if it could be saved, such as when you get a puncture in your tire that has a lot of tread still on it. You don't want to throw the tire away because it has a lot of wear and tear in it. You'd rather plug the puncture and save the tire. Your disc is not a tire, but it does wear down. And sometimes the puncture or the tear in the disc can be saved, can be patched like a tire. All of us have good blood supply to our discs till about age 25 to 30. During that time, the blood supply draws back or pulls away from the discs. And so after age 25 to 30, our discs wear out, and they don't grow back like they did before. So by 40, a person has had about 15 years without blood supply to their discs, and that's why they blow about that time. It doesn't mean the disc is completely gone. There's still a lot to save, and sometimes surgery is not the only solution for that. I was very excited to find in my early training that we could look inside the disc with scopes, tiny scopes that are put through a needle, but still get a good look inside the disc. One of the exciting research findings that came about just about 15 years ago is that the disc is innervated. My dad's generation of physician didn't really treat the disc like it was an innervated structure. So it was thought the disc couldn't feel, so to speak. So that would affect definitely how you treat a disc. Now we know that the outer third of the disc is innervated. It does feel. And they're free nerve endings. And if you tear a disc, those nerves will grow just like roots through that tear into the disc. And the disc is a hydraulic shock absorber. The hydraulic fluid is acidic. So now you have a free nerve growing through a torn disc into acid. So that's why a person has the chronic pain that nothing gets to. Even with medications, physical therapy, all kinds of treatments, you can't get to that free nerve ending that's living in the acid in that torn disc unless you go inside the disc. And until recently, we had to cut a person open to do that. Now, with fluoroscopic procedures, we can often access the disc through a probe or a needle and repair torn discs, or even take out disc material that used to have to be cut out. That was some of the early stuff that got me excited about pain medicine, especially because much of it is spine. I went looking for organizations to help me with my training. At that time, the American Board of Medical Specialties did not recognize pain medicine as a primary specialty. As a matter of fact, it is still under close consideration by them now. But the American Academy of Pain Management and the American Board of Pain Management was formed shortly before then, and since that time have board certified nearly 2,000 pain physicians.
Wow.
That may sound like a big number, but for each of those pain physicians in America, there are over 23,000 people suffering in chronic pain. So it's still a great demand and a little ways to go.
Definitely. Well, what are the most common types of chronic pain that you treat?
Probably the most common is musculoskeletal. If you include all the musculoskeletal pains, certainly heart and cancer pain are common as well.
Right.
Among the musculoskeletal pains, neck and back are the most common. In 2001, the National Hospital Survey reported over 13 million people in the U.S. visited their doctor for neck and back pain alone. So it's very common. Again, in the old days, we used to think that people just got better when they got a backache. Put them in bed for 3 days and a little bit more rest, and they'll just get better. The fact is that most people do get better, but not back to their baseline. They're left with some chronic pain that persists for years or indefinitely thereafter.
Right. And talking more about back pain, what is the cause of common back pain?
In a word, life. We live in gravity, and gravity pounds on us, and we wear out. Most people experience their first memorable back pain when they're bending, twisting, and lifting something. They bent over to pick up their grandchild. They were on the golf course, and that swing, suddenly they had a pain. Sometimes it's a pain they experience out of the blue, and they think back the previous 2 or 3 days to see what they had done. We don't always have a pinpoint incident that we can point to as the cause of the pain, because, as I mentioned before, the discs wear down. After age 25, they start to wear out and don't get rebuilt at the same rate.
Right, right.
So it's not just the one time you bent over and picked up that box the wrong way without bending your knees like you should. It's the 1,000 times before that that added up that led to wearing out the disc till it finally gave way. If you think of the disc as a jelly-filled donut, the jelly can tear into the donut and the donut still stays intact. That's the nucleus, that jelly part, and that nucleus, remember, is acid. If it tears into the donut, you can get back pain, even though the disc is not herniated yet, not blown out.
Right.
And so the many, many times that we've twisted, we've bent, we've sat for a long drive, flown on a long flight, slouched, they add up. And with time, the disc can wear out. And eventually, that nucleus, or that gel, can tear through the outer annulus, the donut part of the disc, and then leak. And that's usually when a person gets the sharp, shooting, sudden, memorable pain. If I probe and ask questions, usually a person can remember that they've had a backache for some time, on and off before that. And that was the harbinger. Right.
Well, what about some of the people that come to you? What kind of symptoms do they tell you that they're feeling? And want questions, what do they ask you about?
You know, I get all types. Most common is neck and back pain. But just the other day, I saw someone with shingles, and that's a little more common than most people realize as well. And she had pain coming from her mid-back, wrapping around her chest all the way to here. It can be very strange for a person to experience the first time. I see folks who are grandmothers who get pain in their wrists from knitting at home, to railroad workers who get a strain of their back working on the job, and athletes and everyone in between. So the complaints are varied, but probably the most common is neck and back pain.
Right. Okay. Well, we're going to have to take a quick commercial break, and when we come back, we'll kind of pick up where we left off, and I have another question about that pain management.
Great.
So we'll be right back after this commercial break.
All the education in the world won't help you get ahead in life if you can't express your ideas effectively. Every day, competition for advancement gets tougher and tougher. You need an edge. A Toastmasters Club can give you that edge. A low-cost learning experience for men and women. Toastmasters gives you the confidence to express your ideas to anyone. Get the Toastmasters edge.
Welcome back to In Our Community, and we're talking with Dr. Vance Johnson. And we have a few viewer questions that we're going to get to, but a little bit later. And first we're going to ask Dr. Johnson, at what point do people seek treatment from their back pain or any kind of pain that they have?
Most people hurt for a little while before they'll go to a doctor. And most of the time that's okay. But by the time they get to me, most patients have seen multiple doctors. Because I'm a pain subspecialist, most patients have gone to see their family doctor and been referred even to other subspecialists along the way. I often ask my patients, how many doctors did you see before you came to see me today? It's rare that it's less than 3. Another question I often ask is, how long have you been suffering with this pain and what has been done? And again, it's rare that I get to see the patient in the time period when it's easiest to treat the problem. So I do a lot of educating to try to get people to understand that the problem is best treated quickly and early. Typically for, say, neck pain and back pain, most people will get better within the first 2 weeks. If by 3 weeks the pain hasn't gotten better, and especially if it's accompanied by referred pain or radiating shooting pains down the limbs, the legs or the arms, or accompanied by numbness, tingling, or weakness, a person should definitely go see their doctor. It's appropriate to go see your family doctor first. In most cases, the pain can be handled that way. The workup can be done appropriately. In some cases, it's not resolved, and so then I get to see the patient, and that may have been weeks, months, sometimes even years. As I mentioned earlier in the program, if a pain goes on long enough, sometimes those alarm centers in the brain that got set off by the original pain can persist in action and continue to cause suffering for the person. And I bring in that word intentionally because most people use the word suffering. It has a different quality. To call it a spirit quality. A person can get injured and have a pain, like I said, in that finger that got pricked by a rose, for example. And the finger can throb and hurt for a little while after. But if that person, say, is a piano player, then it means other things to that person. The subconscious mind might start to worry, might start to wonder whether or not it's going to affect her career, for example, whether or not she'll be able to tickle the keys like she used to, whether or not it'll get infected, whether or not that'll affect her relationship with her husband or her co-workers. It can become quite complicated very fast. And so those other centers can become quite active. If they get out of control, a person can be stuck with that pain for years or lifelong. I certainly like to see a person before that happens. I like to get involved in the case basically 3 weeks into it or so, even that early, because treating the pain aggressively early on can stop that from happening, stop it from becoming chronic in many cases. So I try to do some educating of the referring physicians as well as of Corona to seek out care for pain that's persisting.
Right, and it's very important for people to, before they reach that point where it's unbearable, to be able to seek treatment that they need.
That's right, Erin.
Now, Dr. Johnson, there are many pain management physicians out there. What makes your practice different from everybody else?
You're right, Erin. There are a lot of people saying that they're providing relief for pain in various ways. The internet and media is full of advertisements for that. So a person must do a little research nowadays. Among physicians, anesthesiologists, physiatrists, neurologists, and psychiatrists are the main providers of subspecialty pain care. I'm a physiatrist. Physical medicine and rehabilitation is the longer term for my subspecialty. Like I mentioned before, right away in medical school I was interested in the musculoskeleton, and so I went into physical medicine. I did my residency in physical medicine, and then I narrowed it even further into spine and neurodiagnostics. So my background is very strong in physical medicine and musculoskeletal medicine. That's a little different than, say, an anesthesiologist or a neurologist who do not have musculoskeletal training as a basic part of their residency training.
Right. And what kind of treatments can you offer patients with chronic pain?
There are quite a list of that, Erin. Specifically for spine, as I mentioned earlier, the ones that are most exciting are the ones that are saving discs or saving compressed bones. I mentioned how we could weld, so to speak, a tear in a disc closed to save the disc. I didn't mention how a collapsed bone can sometimes be saved as well. Osteoporosis is a growing problem in our country as well as in Corona, and folks with osteoporosis often experience compression fractures. That's where the vertebrae, the main bone of the spine, collapses on itself, like an accordion collapsing on itself. It can be very painful. Again, we used to think that those always got better, just with time. The statistics show that that's not always true, though. It's quite common to have persistent pain with a vertebral compression fracture. And there really wasn't much to offer a person with that in the past, short of rest, bracing, and medications. Now, again, using fluoroscopic guidance, we can put a probe into that bone and inject bone cement, stabilizing the fracture, just like the orthopedist would do with your broken arm when She puts a cast on your arm, stabilizing the fracture. In this case, it's done from the inside out. And bone cement can stabilize that fracture and give pain relief very quickly. Just last week, I had a patient who had been experiencing pain for almost a year from a compression fracture. And that time period is pretty common. She got to the point where she couldn't deep breathe. She couldn't cough. So much guarding of her torso that she had very little movement. And so it affected her quality of life dramatically. She got relief within 2 hours of the procedure. Not everybody's going to get it that fast, and it's not applicable for everybody, but for the ones it does, it's a big payoff. Very helpful for them. That's one of the exciting treatments.
Right.
There are many, many others. There are advances in medications. Cymbalta is a new medication that recently came out. We're very excited about because it helps both for depression, which is very common in pain patients, as well as pain. And so it can be very helpful. I mention depression now because it is so common. In chronic pain, a person can get worn down. And I have a lot of patients, believe it or not, who feel guilty about that. And I want to say it's not a judgment issue. It's not a character flaw. It's not a personality flaw. Anyone, no matter how strong your character is, will get worn down if they have pain long enough or severe enough. It wears everybody out, no matter what. So treating depression, anxiety associated with pain is very important. It's very exciting to see progress in medications treating that as well. Nerve membrane stabilizers have been a recent change in medications that's exciting as well. Those are medications that basically calm the skin of the nerve cell down. Some people describe that their skin burns and it just feels like it's crawling and stinging, that kind of thing. Well, if you think of the nerve with skin, this medication can kind of suppress that pins and needles sensation. And then, of course, open surgery is still available and improvements are being made there as well. But we really have several new options in non-surgical outpatient procedures, like I mentioned.
All right, well, we got to take another break real quick, and we'll come back and we'll get to those viewers' questions.
Okay.
So we'll be right back after this.
You can take a shot, take a turn, take a spin, take a look at him. Don't take drugs. You can take a walk, take a leap, take a slide, take a ride, ride, ride. Don't take drugs. Your brain gets dizzy, your body goes numb. So if you take drugs, well, that's just dumb. You wanna be strong, you wanna live long. Don't take drugs. Don't take drugs.
Welcome back. I'm talking with Dr. Vance Johnson, pain management physician, and we're going to get to those questions that some viewers have. And this one comes from Tanya in Corona, and she says, I've been told that I have scoliosis. Is this something serious? I have no back pain.
Tanya, scoliosis can be serious. In most cases, it's not, though. One of the ways it's found is screening at school during the high growth years, early teens. Sometimes it's found incidentally, but we really get concerned about it when the curve in the spine gets to be more than 10 degrees. Before that, not a lot is done about it other than good living. When it gets to be beyond that, yeah, you need to see your doctor about it, and it needs to be followed up. In severe cases, bracing is done through the growing years, and even more severe cases, surgery is done to put rods along nearly the full length of the spine to straighten it out.
Right. The next one we have is from Paula in Corona, and she asks, how important is the pillow I use, and should I be sleeping on a firm mattress?
Great question, because we spend so much time in bed. The pillow is important. God created us with a certain posture, and if we spend a third of our lives twisted in bed, then we're going to pay. So when you lie in bed, if you lie on your side, for example, you want a pillow that keeps your head about right here. If you're lying on your side and it's like this for 6 or 7 hours, you should expect to have some neck pain eventually over the years. So you want your pillow to push you right about here, not to here. But again, lying on your side, your shoulders can kind of collapse like that. So it's good to hug a pillow or hug someone you love, and also have a pillow between your knees because your hips can collapse as well. I know the pillows are adding up, but you asked.
All right. And our next question we have is, does diet play an important role in chronic back pain? That's from Roxanne in Riverside.
Roxanne, that's a great question. Of course, diet does play an important role in all health issues. In spine pain, diet plays an important role because we're in gravity, and lots of us are carrying a few extra pounds. Once you get a herniated disc or damage to the spine, it can aggravate the problem. Most of my back patients, if I put a 50-pound backpack on them and asked them to carry it till bedtime, would not be happy with that. It would definitely hurt a lot. But some of them are carrying that much extra weight. So yes, diet can make a big difference. The big offenders are fried foods and animal fats, because not only do those put a lot of weight on us, but they're inflammatory. Simple sugars are inflammatory as well. And inflammation is troublesome with pain because if it persists, it causes damage. It's low pH, it's acidic, it can cause scarring and more pain. So we don't like inflammation to linger around. So diet can definitely affect your inflammation level as well.
All right, and let's take one more question we have here. Is physical therapy a good way to help chronic back pain? And that comes from Clark in Corona.
Clark, physical therapy is one of the foundations of treatment for chronic back pain. So yes, definitely, it can be very helpful. It's especially helpful for retraining muscles of the torso. If you think of your torso, this area of your body, the center of your body, it's like a cylinder or a pipe. And you know, if that cylinder or pipe gets a ding or a dent in it, it'll collapse. Without that dent, pipes are very strong. The cylinder is a structure that's very strong. It can handle a lot of vertical force. So if you think of your torso as a cylinder, the ding that happens in that cylinder for lots of people is the soft area here. It gets soft. As a matter of fact, I have patients that often want to wear braces because it makes them feel good. Those braces are doing things that the torso muscles should have been doing. And that's why the person feels good with that brace on. And even a person wearing a brace for too long can weaken the muscles underneath that brace, making the back pain even worse. So physical therapy can be very helpful at educating you on how to take care of your spine, retraining muscles that need to be retrained, and teaching you how to take care of your spine the rest of your life by giving you a home exercise program. So you become your own physical therapist, basically for the rest of your life. When we're young, we often don't think about the things needed to do to save our health, to take care of our spine, because we're invincible. But once you've got damage to a disc or a facet joint in the spine, it's going to be there to some degree or another for the rest of your life, and you need to learn to take care of it. So you've got to become educated, and physical therapy can be very helpful for that.
All right, Dr. Johnson, as we close up here, what advice can you give our viewers who are suffering from pain?
Well, first, make sure you've got the basic fundamentals of health in place. There's not much a doctor or anyone else can do for you if you're not sleeping right, eating right. You've got to sweat hard once every day. You've got to laugh hard once every day. You've got to have good relationships with other people. You've got to have good relationship with God or a higher power. You've got to drink plenty of water and get plenty of fresh air and sunshine. If you've got those 8 principles in place, then you've got something to work with. If you don't, it's really hard to help you. When you've got those in place, or if you need help getting those in place, see your doctor. At your pain care clinic of Corona, my clinic here just across the street from Corona Regional Medical Center, we try and help them get those 8 principles in place. But it really takes a lot of work on the patient's part, and that's where the team effect comes into play. I work with the patients to help them improve their lifestyle, as well as provide some of the interventions that can get them over the hump, knock the pain down, which allows them to participate more in things like physical therapy, the sweat hard once a day principle kinds of things. So combining our efforts can give great success.
All right, and Dr. Johnson, how can our viewers contact you for more information?
Simply 951-699-2777. Just across the street from Corona Regional Medical Center, 900 South Main Street.
All right, well, thank you so much, Dr. Johnson. I know pain management is something that everybody is affected by or knows somebody who is, so it's great to have that information.
Thank you, Erin.
All right, thank you so much. And thanks for watching. We'll see you next time.